I had a placenta previa up until 33 weeks of pregnancy, and I realized that if I were not a labor and delivery nurse, I would be so nervous about having a C-section. And I realized that the OR is sterile, and so most of the time as a patient, you cannot tour the OR, and so you have no idea what to expect. So this is an example of what an OR looks like, and I'm going to go through the basics of the basics just so it calms your nerves and you kind of know what to expect if you're going to be having a routine C-section. So once you get to the hospital, they're going to get you all prepped and put baby on the monitor, do some paperwork. You'll probably meet your surgeon and your anesthesiologist. They will prep the OR, and then they'll bring you back, and you will sit on the OR table, and the anesthesiologist will give you an injection in your spine. It's kind of like an epidural, but it's just like a shot, and it only numbs you for a certain amount of hours. Once you get that injection, and it'll start taking effect pretty quickly, they will lay you down on your back on the OR table, and the anesthesiologist will put up a sheet and get some fluids flowing. Once all of those steps are done, your team is going to be ready to do the C-section, and at that point is when they usually bring your spouse into the OR with you. So your spouse, your significant other, whoever you're bringing with you into the OR, usually you can only bring one person, will be there when they actually do the incision. Once the doctor makes the incision, everything's going to move fairly quickly. I mean, you will probably hear your baby crying within 15 minutes or probably less. If baby is doing really well, they'll still do the delayed cord clamping, the 60 seconds, and then they'll bring baby over to you so you can just see what baby looks like. Then they'll bring baby over to the warmer, and they'll just dry baby and wrap baby up, and then give baby to your second person. And sometimes you can do skin to skin, so they'll put baby on you, but you just might need some extra assistance holding baby with your second person that you brought, or the nurse might stand there with their hand on baby and just let you do a little bit of bonding with baby. During this time, the doctor will be closing you back up, and then within 20 minutes or so, you should be back in your postpartum room. Some units transfer you into a postpartum room, so if you are being transferred to a different room, then you'll stay with your labor and delivery team until you're fully recovered, and then they'll transfer you over to your postpartum. Usually when you get back to your room, you'll still have a Foley catheter, and you probably won't get out of bed until you're fully stable, your blood pressures are good, your blood loss is good, and within 8 hours, usually they'll remove the Foley catheter and you'll be up walking around. Women are amazing. We have a full abdominal surgery, a C-section, and then within 8 hours, we're up and walking around and holding our baby and breastfeeding. It's amazing. Also, once you're feeling up to it, you can breastfeed right away. So as soon as you get back to your room, if baby's hungry, some women just don't feel up to it, and that's totally okay. If that happens and you cannot breastfeed, then the team can give baby formula, and as soon as you're ready, we will assist you with breastfeeding again. I hope that calms any nerves that you might have about having a routine C-section, and if you have any questions, then I'll be more than happy to answer them in the comments.